High blood pressure or hypertension is a medical condition in which the force of blood on the walls of the arteries is often too high. Arteries are the blood vessels that carry blood away from the heart to supply the tissues with oxygen and nutrients. In the heart, two chambers called ventricles contract with each heartbeat to push blood to the lungs and through the arteries to the rest of the body. As blood flows through them, three main factors affect the blood pressure on the artery walls. The first is cardiac output, or the amount of blood the ventricles push out of the heart each minute. The blood pressure goes up as cardiac output increases. The second factor affecting the blood pressure is blood volume, or the total amount of blood in the body. Blood pressure also goes up as blood volume increases. The third factor that affects the blood pressure is resistance, which is anything working against the blood flow through the arteries. Several factors contribute to resistance. One resistance factor is the flexibility of the artery wall. Healthy arteries expand with each heartbeat to help reduce the blood pressure on the wall. Another resistance factor is the diameter of the arteries. The body is able to increase the diameter of the arteries to lower the blood pressure or reduce the diameter to raise the blood pressure. A third resistance factor is blood viscosity or thickness. In the blood, more particles such as proteins and fats increase viscosity. If the blood is thicker, the blood pressure goes up as the heart works harder to push it through the arteries. The blood pressure can be measured with a device called a sphygmomanometer or blood pressure curve. When the heart beats, the pressure of blood on the walls of the arteries is called systolic pressure. When the heart relaxes between beats, pressure on the artery wall is called diastolic pressure. While the blood pressure may change throughout the day, it should normally be less than 120 mm of mercury for systolic pressure and less than 80 mm of mercury for diastolic pressure. If the systolic pressure frequently stays above 140 or the diastolic pressure frequently stays above 90, that is hypertension or high blood pressure. Over time, high blood pressure will damage the walls of the arteries. The artery wall may become weak and form an enlargement called an aneurysm, or the wall may burst and bleed into the surrounding tissue. Small tears in the artery wall may attract certain substances in the blood such as cholesterol, fats, and calcium to form a build-up called a plaque. Blood flow through the artery decreases as the plaque enlarges. Blood cells can stick to the plaque and form a solid clumps called clots, further reducing or completely blocking the blood flow. Damage to the arteries raises the blood pressure even more by making the heart beat more forcefully. Artery damage and reduced blood flow leads to conditions such as a stroke, heart attack, or kidney disease. In most cases, the cause of hypertension or high blood pressure is unknown. This type of hypertension is called primary or essential hypertension.